What is pharmacogenomics? A. Study of how drugs act on the body. B. Study of how genes affect a person's response to drugs. C. Study of drug interactions in the body. D. Study of drug manufacturing processes. The correct answer is B. Pharmacogenomics is the study of how genes affect a person's response to drugs. Which of the following is not a goal of pharmacogenomics? A. Personalized medicine. B. Reduce adverse drug reactions. C. Increase cost of drug development. D. Improve drug efficacy. The correct answer is C. Increasing the cost of drug development is not a goal of pharmacogenomics. Which genetic variation can affect how a patient responds to a drug? A. Eye color. B. Hair texture. C. Single nucleotide polymorphisms, or SNPs. D. Foot size. The correct answer is C. Genetic variations, like single nucleotide polymorphisms, or SNPs, can affect drug response. What does the field of pharmacogenomics aim to achieve? A. One-size-fits-all approach to drug therapy. B. Individualized treatment based on genetic makeup. C. Increased trial and error in drug prescribing. D. Standardized drug dosages for all patients. The correct answer is B. Pharmacogenomics aims for individualized treatment based on genetic makeup. Which term refers to the study of genetic variations across the entire genome? A. Pharmacogenetics. B. Genomic medicine. C. Transcriptomics. D. Proteomics. The correct answer is B. Genomic medicine refers to the study of genetic variations across the entire genome. How can pharmacogenomics help reduce adverse drug reactions? A. By increasing the dosage of medications. B. By identifying genetic factors that affect drug metabolism. C. By using a one-size-fits-all approach to drug therapy. D. By disregarding genetic variations in drug response. The correct answer is B. Pharmacogenomics can help reduce adverse drug reactions by identifying genetic factors that affect drug metabolism. Which of the following is an example of a pharmacogenomic test? A. Measuring blood pressure. B. Checking cholesterol levels. C. Testing for the presence of HLA-B*5701 before prescribing abacavir. D. Checking blood glucose levels. The correct answer is C. Testing for HLA-B*5701 before prescribing abacavir is an example of a pharmacogenomic test. Why is pharmacogenomics important in cancer treatment? A. It increases the cost of cancer drugs. B. It helps tailor treatment based on genetic mutations in tumors. C. It leads to a one-size-fits-all approach to cancer therapy. D. It reduces the need for chemotherapy. The correct answer is B. Pharmacogenomics helps tailor cancer treatment based on genetic mutations in tumors. Which term refers to the study of how an individual's genetic makeup affects their response to drugs? A. Pharmacogenomics. B. Pharmacokinetics. C. Pharmacodynamics. D. Pharmacotherapy. The correct answer is A. Pharmacogenomics focuses on how genetic makeup affects drug response in individuals. What can healthcare providers do with pharmacogenomic information? A. Ignore it and prescribe drugs based on age alone. B. Personalize drug treatment based on genetic factors. C. Guess the appropriate drug dosage for a patient. D. Disregard patient genetic factors in drug therapy. The correct answer is B. Healthcare providers can personalize drug treatment based on genetic factors identified through pharmacogenomic information. What is the primary focus of pharmacogenomics? A. Studying the effects of drugs on different populations. B. Analyzing how genetic variations influence drug response. C. Developing new drugs based on genetic sequences. D. Examining the side effects of drugs on patients. The correct answer is B. Pharmacogenomics focuses on how genetic variations influence drug response in individuals. Which term describes customizing drug treatment based on a person's genes? A. Pharmacogenomics. B. Pharmacodynamics. C. Pharmacokinetics. D. Pharmacotherapy. The correct answer is A. Pharmacogenomics involves customizing drug treatment based on individual genetic variations. How can pharmacogenomics help select the most effective medication for a patient? A. By analyzing the patient's diet. B. By testing the patient's blood type. C. By considering the patient's genetic makeup. D. By assessing the patient's lifestyle habits. The correct answer is C. Pharmacogenomics can help select the most effective medication by considering a patient's genetic makeup and how they may respond to certain drugs. Which type of genetic variation can impact drug metabolism in the body? A. Chromosomal abnormalities. B. Single nucleotide polymorphisms, or SNPs. C. Mitochondrial mutations. D. Epigenetic modifications. The correct answer is B. Single nucleotide polymorphisms, or SNPs, are a type of genetic variation known to impact drug metabolism and response in individuals. Why is pharmacogenomics considered a promising approach in modern medicine? A. It allows for one-size-fits-all drug prescriptions. B. It minimizes the need for genetic testing. C. It enables personalized medicine based on individual genetics. D. It focuses solely on environmental factors impacting drug response. The correct answer is C. Pharmacogenomics enables personalized medicine by considering individual genetics, leading to more tailored and effective treatments. Which of the following is a potential benefit of pharmacogenomic testing for patients? A. Increased risk of drug interactions. B. Improved drug efficacy and safety. C. Reduced need for medical consultations. D. Higher likelihood of adverse drug reactions. The correct answer is B. Pharmacogenomic testing can lead to improved drug efficacy and safety by identifying the most effective medications for individual patients. In pharmacogenomics, what do poor metabolizer and ultra-rapid metabolizer mean? A. Drug dosing guidelines. B. Genetic mutations affecting drug response. C. Type of pharmaceutical companies. D. Methods of drug administration. The correct answer is B. In pharmacogenomics, poor metabolizer and ultra-rapid metabolizer refer to genetic mutations that can affect how individuals respond to certain drugs. How does pharmacogenomics contribute to reducing healthcare costs? A. By promoting unnecessary genetic testing. B. By increasing the number of prescribed medications. C. By optimizing drug therapy and reducing adverse reactions. D. By neglecting patient genetics in treatment plans. The correct answer is C. Pharmacogenomics can help optimize drug therapy, leading to more effective treatments and potentially reducing healthcare costs by minimizing adverse drug reactions. Which aspect of drug development can benefit from pharmacogenomics insights? A. Decreasing reliance on clinical trials. B. Increasing drug manufacturing costs. C. Enhancing drug efficacy and safety profiles. D. Skipping regulatory approval processes. The correct answer is C. Pharmacogenomics insights can enhance drug development by improving drug efficacy and safety profiles, leading to more tailored treatments for patients. How might pharmacogenomics influence the future of pharmacy practice? A. By standardizing drug prescriptions for all patients. B. By emphasizing drug price over efficacy. C. By providing personalized treatment plans based on individual genetics. D. By disregarding patient genetic variations in drug responses. The correct answer is C. Pharmacogenomics may shape the future of pharmacy practice by focusing on personalized treatment plans that consider individual genetic variations in drug responses. Which genetic variation can affect how a patient metabolizes a drug? A. Single nucleotide polymorphism, or SNP. B. Deletion mutation. C. Duplication mutation. D. Frameshift mutation. The correct answer is A. Single nucleotide polymorphisms, or SNPs, are common genetic variations that can impact drug metabolism. What is the main goal of pharmacogenomics testing? A. To tailor drug treatment to an individual's genetic makeup. B. To identify rare genetic disorders. C. To predict future health issues. D. To study genetic mutations. The correct answer is A. Pharmacogenomics testing aims to customize drug treatment based on an individual's genetic makeup. Which of the following is an example of a pharmacogenomics application in pharmacy practice? A. Identifying genetic disorders. B. Customizing drug dosage based on weight. C. Testing for genetic variations that impact drug response. D. Monitoring adverse drug reactions. The correct answer is C. Pharmacogenomics involves testing for genetic variations that influence drug response. How can pharmacogenomics help improve treatment outcomes for patients? A. By reducing the cost of medications. B. By minimizing adverse drug reactions. C. By increasing the availability of prescription drugs. D. By shortening the duration of treatment. The correct answer is B. Pharmacogenomics can help minimize adverse drug reactions by tailoring treatment to the patient's genetic profile. Which type of genetic variation can affect drug transporters and alter drug distribution in the body? A. Copy number variations. B. Insertion mutation. C. Substitution mutation. D. Inversion mutation. The correct answer is A. Copy number variations can impact drug transporters and change drug distribution in the body. How does pharmacogenomics contribute to personalized medicine in pharmacy practice? A. By standardizing drug dosages for all patients. B. By identifying genetic factors that influence drug response. C. By limiting the types of medications available to patients. D. By increasing the number of medications prescribed. The correct answer is B. Pharmacogenomics helps identify genetic factors that affect how individuals respond to drugs, enabling personalized medicine. What is the significance of pharmacogenomics in reducing healthcare costs? A. It leads to lower costs for genetic testing. B. It decreases hospitalization rates. C. It reduces the number of prescribed medications. D. It minimizes adverse drug reactions and unnecessary treatments. The correct answer is D. Pharmacogenomics can help lower healthcare costs by minimizing adverse drug reactions and unnecessary treatments based on genetic information. How can healthcare providers use pharmacogenomic information to optimize patient care? A. By prescribing multiple medications simultaneously. B. By ignoring genetic variations in drug response. C. By adjusting drug dosages based on genetic makeup. D. By relying solely on patient symptoms for treatment decisions. The correct answer is C. Healthcare providers can optimize patient care by adjusting drug dosages according to the patient's genetic makeup, as revealed by pharmacogenomic information. Which term describes the study of genetic variations affecting a person's response to a specific drug? A. Pharmacokinetics. B. Pharmacodynamics. C. Pharmacogenomics. D. Pharmacotherapy. The correct answer is C. Pharmacogenomics focuses on genetic variations that influence how individuals respond to specific drugs. In pharmacogenomics, what does ultra-rapid metabolizer mean for drug response? A. A patient who breaks down medications at a slower rate. B. A patient who breaks down medications at a faster rate. C. A patient who is resistant to drug treatment. D. A patient who experiences severe side effects from drugs. The correct answer is B. An ultra-rapid metabolizer is a patient who breaks down medications at a faster rate, potentially affecting the efficacy and safety of the drug. What is the primary focus of pharmacogenomics? A. Studying the effects of drugs on the body. B. Customizing drug treatment based on genetic makeup. C. Identifying new drug targets. D. Developing generic medications. The correct answer is B. Pharmacogenomics focuses on customizing drug treatment based on an individual's genetic makeup. How can pharmacogenomics help reduce adverse drug reactions? A. By increasing the dosage of medications. B. By prescribing more drugs simultaneously. C. By tailoring drug treatment to an individual's genetic makeup. D. By using standard drug dosages for all patients. The correct answer is C. Pharmacogenomics helps reduce adverse drug reactions by tailoring drug treatment to an individual's genetic makeup. Which term describes customizing drug treatment based on someone's genes? A. Pharmacokinetics. B. Pharmacodynamics. C. Pharmacogenomics. D. Pharmacovigilance. The correct answer is C. Pharmacogenomics refers to customizing drug treatment based on an individual's genetic makeup. How does pharmacogenomics contribute to reducing healthcare costs? A. By increasing the cost of genetic testing. B. By optimizing drug treatment and reducing adverse reactions. C. By developing new expensive medications. D. By standardizing drug dosages for all patients. The correct answer is B. Pharmacogenomics helps reduce healthcare costs by optimizing drug treatment and reducing adverse reactions. Which aspect of drug development can benefit from pharmacogenomics insights? A. Decreasing the need for clinical trials. B. Identifying potential drug targets. C. Increasing the cost of drug development. D. Simplifying the drug approval process. The correct answer is B. Pharmacogenomics insights can benefit drug development by identifying potential drug targets. How may pharmacogenomics influence the future of pharmacy practice? A. By reducing the need for pharmacists. B. By increasing the cost of medications. C. By shifting towards personalized medicine. D. By standardizing drug treatments for all patients. The correct answer is C. Pharmacogenomics may influence the future of pharmacy practice by shifting towards personalized medicine. What is the significance of pharmacogenomics in reducing healthcare costs? A. It increases the cost of medications. B. It optimizes drug treatments and reduces adverse reactions. C. It standardizes drug dosages for all patients. D. It leads to more clinical trials. The correct answer is B. The significance of pharmacogenomics in reducing healthcare costs is that it optimizes drug treatments and reduces adverse reactions. How can healthcare providers use pharmacogenomic information to optimize patient care? A. By ignoring genetic variations in drug responses. B. By customizing drug treatments based on genetic makeup. C. By prescribing standard drug dosages for all patients. D. By increasing the number of medications prescribed. The correct answer is B. Healthcare providers can use pharmacogenomic information to optimize patient care by customizing drug treatments based on genetic makeup. Which term describes the study of genetic variations affecting a person's response to a specific drug? A. Pharmacovigilance. B. Pharmacokinetics. C. Pharmacodynamics. D. Pharmacogenomics. The correct answer is D. The study of genetic variations that affect an individual's response to a specific drug is known as pharmacogenomics. In pharmacogenomics, what does ultra-rapid metabolizer mean for drug response? A. An individual who metabolizes drugs slowly. B. An individual who is allergic to medications. C. An individual who rapidly metabolizes drugs. D. An individual who does not respond to medications. The correct answer is C. Less than break time equals 1s greater than. In pharmacogenomics, an ultra-rapid metabolizer rapidly metabolizes drugs. What is the purpose of pharmacogenomics testing? A. To customize drug treatment based on an individual's genetic makeup. B. To diagnose genetic disorders. C. To predict future genetic mutations. D. To identify potential candidates for gene therapy. The correct answer is A. Pharmacogenomics testing aims to customize drug treatment based on an individual's genetic makeup, ensuring the most effective and safe medication is prescribed. Which genetic variation can impact how a patient responds to a drug? A. Single nucleotide polymorphisms, or SNPs. B. Chromosomal rearrangements. C. Translocations. D. Gene duplications. The correct answer is A. Single nucleotide polymorphisms, or SNPs, are common genetic variations that can affect drug metabolism and response in patients. How can pharmacogenomics help predict adverse drug reactions? A. By analyzing a patient's family medical history. B. By screening for common illnesses. C. By studying genetic variations that impact drug metabolism. D. By performing physical exams. The correct answer is C. Studying genetic variations that impact drug metabolism through pharmacogenomics can help predict and prevent adverse drug reactions. Which term describes the field that studies how an individual's genetic makeup influences their response to drugs? A. Pharmacogenomics. B. Pharmacokinetics. C. Genetic counseling. D. Genomics. The correct answer is A. Pharmacogenomics focuses on how genetic variations affect drug response, guiding personalized medicine. What is the potential benefit of pharmacogenomic testing for patients? A. Increased cost of medication. B. Reduced risk of adverse drug reactions. C. Greater waiting times for treatment. D. Higher frequency of hospital visits. The correct answer is B. Pharmacogenomic testing can reduce the risk of adverse drug reactions, improving patient safety and treatment outcomes. Which type of genetic variation can affect drug transporters and alter drug distribution in the body? A. Copy number variations. B. Inversions. C. Insertions. D. Deletions. The correct answer is A. Copy number variations are genetic changes that can impact drug transporters, affecting drug distribution and response in the body. Why is pharmacogenomics important in modern medicine? A. To standardize drug treatments for all patients. B. To reduce the need for healthcare providers. C. To personalize medication choices based on genetic factors. D. To increase the cost of healthcare services. The correct answer is C. Pharmacogenomics allows for personalized medication choices tailored to each individual's genetic makeup, improving treatment efficacy and safety. Which term refers to the study of genetic variations across the entire genome? A. Genomics. B. Pharmacogenetics. C. Genetic profiling. D. Mutation analysis. The correct answer is A. Genomics encompasses the study of genetic variations across the entire genome, providing insights into drug response and disease susceptibility. How can healthcare providers use pharmacogenomic information to optimize patient care? A. By prescribing medications based on intuition. B. By adjusting drug doses randomly. C. By tailoring drug treatments to a patient's genetic profile. D. By ignoring genetic factors in medication choices. The correct answer is C. Healthcare providers can optimize patient care by tailoring drug treatments to a patient's genetic profile, reducing adverse reactions and improving treatment outcomes. What can pharmacogenomics contribute to in terms of reducing healthcare costs? A. Increase in unnecessary medical procedures. B. Decrease in medication trial and error approaches. C. Higher expenses for genetic testing. D. More hospital admissions. The correct answer is B. Pharmacogenomics can reduce healthcare costs by decreasing the need for medication trial and error. This leads to more effective and efficient treatment strategies. What does the term pharmacogenomics refer to in the field of pharmacy? A. The study of how an individual's genetic makeup affects their response to drugs. B. The study of drug interactions in the body. C. The study of drug manufacturing processes. D. The study of drug pricing strategies. The correct answer is A. Pharmacogenomics is the study of how an individual's genetic makeup affects their response to drugs, leading to personalized medicine. Which of the following genetic variations can impact drug transporters and alter drug distribution in the body? A. Single nucleotide polymorphisms, or SNPs. B. Insertions and deletions. C. Copy number variations. D. Mitochondrial DNA mutations. The correct answer is C. Copy number variations are a type of genetic variation. They can affect drug transporters and alter drug distribution in the body, influencing how drugs are metabolized. How can pharmacogenomics help predict adverse drug reactions? A. By analyzing the patient's medical history. B. By considering the patient's lifestyle choices. C. By assessing the patient's genetic makeup. D. By checking the patient's age and gender. The correct answer is C. Pharmacogenomics can help predict adverse drug reactions by assessing a patient's genetic makeup and identifying genetic variations that may impact drug metabolism. What is the main focus of pharmacogenomics in pharmacy practice? A. Optimizing drug manufacturing processes. B. Creating generic drug alternatives. C. Personalizing drug treatment based on genetic makeup. D. Standardizing drug dosages for all patients. The correct answer is C. The main focus of pharmacogenomics in pharmacy practice is personalizing drug treatment based on an individual's genetic makeup to improve treatment outcomes. Which term describes the field studying how someone's genes affect their drug response? A. Pharmacoeconomics. B. Pharmacokinetics. C. Pharmacogenomics. D. Pharmacodynamics. The correct answer is C. Pharmacogenomics studies how your genes affect how you react to drugs. This leads to personalized medicine and better treatment.